Welcome everyone to the third session of our 2021 webinar series, Africa's Readiness for the COVID-19 Vaccination Drive, brought to you by Africa Health Business. My name is Kaushal Shah and I'm the head of Pharma and MedTech at the firm. Before we start the discussion, I'd like to take you through some housekeeping rules. Attendees will be on mute during the session and this webinar will be in English. This is a 90-minute event. Please note that you can post your questions in the Q&A section on your screen and your questions will be responded to as much as possible. Throughout the webinar, there will be pop-up questions and we encourage you to respond. The results of these questions will be shared with you towards the end of the webinar. I would also like to take this opportunity to introduce you to Africa Health Business. We are a Pan-African boutique consultancy and advisory firm based in Nairobi that aims to improve access to equitable health in Africa. Through a private sector lens, we provide organizations with actionable insights to grow their health agenda in Africa. This slide will show you today's agenda. I'd like to reiterate that this is a 90-minute session. So to kick off the discussion today, I'd like to take you through this slide. The speed at which the COVID-19 vaccine was developed is the medical breakthrough of our lifetimes, with the scientific community creating multiple candidates within a year of the discovery of the novel virus. Now, the focus has shifted to how successfully and quickly the vaccines can be administered to the global population. The scale of the challenge is immense, and for Africa, this is the largest immunization drive in the continent's history. Government bodies, policymakers, healthcare professionals, the private sector, development organizations, and other stakeholders will need to work collaboratively to roll out immunization programs across a continent of more than 1.3 billion people. As this slide shows, successful rollout of vaccines will require the timely execution of an interconnected chain of processes, pre-vaccine delivery, during the vaccine delivery, and also post-vaccine delivery. So we need to secure access to sufficient volumes of the vaccine. And once we get them, we need to set up cold storage facilities, build the capacity of our health workforces, educate the public, prioritize target populations, and then maintain immunization registries. To date, in total, 44 African countries have received the vaccine through the COVAX facility, the African Vaccine Acquisition Task Team, and through other agreements. While the vaccine deliveries in the first quarter of 2021 have enabled many countries to roll out vaccinations, the continent is yet to secure adequate volumes of the vaccines. At the end of March 2021, 548 million vaccine doses had been administered globally. However, Africa had only administered 10 million vaccines, and only 1.8% of the total global vaccines were in Africa. To achieve the goal of vaccinating 60% of the population on the continent required to attain herd immunity, African countries need to establish robust systems. An inadequate cold chain will lead to vaccine spoilage. Inadequately trained workforces will lead to vaccine wastage. So the big question is, what will it take to ensure effective vaccine deployment in Africa? With that question in mind, as we move on to today's discussion, I'd like to introduce our fantastic panel for today. The keynote speaker, here we go. Here's one poll question. If you could please take time to answer it while I introduce the panel. So the keynote speaker for today is Dr. Mulaken Johannes, the Immunization Senior Advisor and National Coordinator of COVID-19 vaccine rollout in Ethiopia. We also have Ms. Tara Prasad, the Senior Manager for the ACT COVAX Coordination Secretariat for Supply for the UNICEF Supply Division. We have Dr. Nikesh Dembi, the Senior Science Advisor from the Africa Centers for Disease Control and Prevention. We have Mr. Sanjeev Gadia, the Chief Executive Officer of Astral Aviation, Dr. Ernest Darko, the Founding Partner for Burridge Healthcare, and Professor Asor, the Technical Director of Programs for Amref Health Africa. Each speaker will provide us with much needed knowledge and experience of the different phases of vaccine deployment, allowing us to adopt more efficient immunization programs, as in reality, we are just at the start of Africa's largest immunization drive. On this note, I'd like to welcome Dr. Johannes to speak to us about Ethiopia's COVID immunization campaign and about the country's experience so far, as Ethiopia actually received its first COVAX delivery of 2 million vaccines exactly a month ago. Over to you.
Thank you very much, distinguished guests, ladies and gentlemen. Good morning, good evening, and good afternoon. First and foremost, I would like to express my gratitude for African Health Business Symposium for organizing such an important event. I am presenting this opening remark on the behalf of Her Excellency Minister Lia, Minister of Health in Ethiopia, who is not with us today because of urgent and unavoidable matter. I can assure you Her Excellency is feeling so sorry for missing this vital event, who were preparing to attend and to give this opening remark throughout the week. Ladies and gentlemen, the COVID-19 pandemic has caused a substantial excess mortality and plunged national economies into a deep recession. Although the spread of the virus can be mitigated through a physical distance, face coverings, and testings, and tracing, and potentially with therapeutics, the risk of outbreaks and disruption to the economic and social life will probably remain until effective vaccines are administered to a large portion of the global population to prevent hospitalization and severe cases, and preferably achieve the herd immunity to halt the transmission of the virus. Several COVID-19 vaccines have now been authorized or approved for human use, with many more in the late stage of clinical development. The COVID-19 pandemic is unlikely to end until there is a global rollout of vaccine that protect against severe disease and preferably drive herd immunity. Regulators in numerous countries have authorized or approved COVID-19 vaccine for human use, with more expected to be licensed in 2021. Yet, having licensed vaccines is not enough to achieve the global control of COVID-19. They also need to be produced at scale, priced affordably, and allocated globally so that they are available where needed and widely deployed in the local communities. Distributing COVID-19 vaccines quickly and equitably is essential to end this pandemic, restart our economies, and begin to tackle the other great challenges of our time, like food insecurity, inequalities, and the climate crisis. Health must be fundamental to all the development in the post-COVID world, and investing in the primary healthcare system will be a key to ending this pandemic, preparing for the next one, and delivering on the vision for health for all. As we speak now, the COVID-19 virus continues to spread rapidly and is creating a huge economic and social public health challenge worldwide. Now, more than ever, it is a paramount that Africa countries initiate more aggressive and robust strategies to effectively contain the pandemic. Although currently an effective vaccine is ready, its distribution is very limited, and hence an important way in which to reduce transmission is to identify and isolate individuals who are really contagious. As Africa is reviving up to roll out COVID-19 vaccines, vaccine rollout preparations plans will help to ensure African countries hit the ground running and quickly immunize the most vulnerable people. Meticulous planning is not only a key to ensure the COVID-19 vaccine reach all priority groups wherever they are in every single African countries, but also address the challenges in the vaccine access, procurement, financing, and delivery and uptake. To this end, we need active leadership and engagement from the highest level of the government with solid, comprehensive, and national coordinated plans and the system put in place. The move to roll out COVID-19 vaccines comes as the new evidence shows new variants of the virus are spreading across the continent. Currently, most African countries have detected the new variants. The pandemic spreads faster than the second wave than the first one. Our priority, hence, must be to protect the most vulnerable from severe illness and death, along with rolling out of safe and proven vaccines. We must also work towards a diverse vaccine portfolio. At the same time, manufacturers must be prepared to adjust to mutations of the virus, including potentially providing a booster shots and adapted vaccines. If communities are not on board and convinced that a vaccine will protect their health, it will be too difficult to make visible progress. Hence, it is very critical that countries reach out to communities and hear their concerns and give them a voice in the process. Finally, global, national, and local leaders need to accelerate the equitable rollout of the vaccine in every country, starting with the health workers and those at high risk for COVID-19 morbidity and mortality. Additionally, scaling up of vaccine manufacturing, rejecting vaccine nationalism at every turn to end this pandemic globally. Last but not least, world leaders need to have a courage and a commitment to increase contribution to the COVAX facility and to share doses with the COVAX in parallel with the national vaccine rollout. I thank you all and wish you a successful and a fruitful meeting ahead. Thank you. Over to you.
Thank you, Dr. Moloken. Would you be able to give us a quick, brief outline of how the rollout has gone in Ethiopia so far? What has your experience been on the ground in Ethiopia?
Yeah, thank you. I think the vaccine rollout in Ethiopia has started. I think the vaccine has arrived March 7, and just a week after of the vaccine arrival, like March 13, we have started, the rollout. So the rollout was actually simultaneous across all the regions, including one at the capital city. And we have started actually the vaccine rollout based on the policies that was already developed prior to the arrival of these vaccines. So according to these policies, healthcare providers were top on the list to get the vaccines, and subsequently then age 65 and above blanketly, and 55 up to 65 with a comorbidity. So far, the vaccine rollout is going very well. But Ethiopia is a very big country. In the routine immunization period, the vaccine rollout by itself actually takes time. So we are actually finalizing the vaccine distribution, and so far we have vaccinated a good number of healthcare providers as well as the aged and individuals with comorbidities. And we don't have such a big programmatic challenge so far, apart from a few adverse effects, one or two adverse effects, and we are doing casualty analysis why those severe adverse effects have occurred. Apart from this, everything is going smooth, and I think we will achieve the targets that is already put out for addressing the aged population as well as individuals with comorbidity, as well as the healthcare providers by the time vaccine is reached at all corners, at all healthcare facilities, and definitely this will boost our number of vaccinated targets. So all in all, this is the progress. And sorry, I don't have numbers, but so far we were able to, again, with regard to the numbers, I think we need to be very cautious because the numbers people are actually focusing on providing vaccines, so they are not actually targeting providing figures. But I think so far we were able to vaccinate 171,175, and I don't think this figure showed the whole picture, but we are expecting the report to come from all corners of the country. Thank you.
Great, thank you so much. Thank you for your opening and for answering my question. I'd like to now hand over to Ms. Tara Prasad, who will speak about, actually we have another pop-up question, so please also take your time to answer that. So yeah, I'd like to hand over to Ms. Tara Prasad, who will speak about COVAX and the success of the vaccine rollout so far. Thank you.
Thank you, Kaushal. Can you hear me clearly?
Yes, I can, thanks.
Fantastic. Hi, everybody. I'm very happy to be here with this distinguished panel. I'd like to start by thanking Africa Health Business Symposium for organizing this event, bringing us all together and playing a role to help foster collaborations in the successful rollout of COVID-19 vaccines across the African continent. I personally have been working on access to medicine issues for most of my career, so COVAX is really where passion meets purpose, and it's really an honor to be working to solve one of the greatest challenges of our time. Today, I'm going to talk to you about COVAX. I'll provide you with an overview, go over UNICEF's role, and describe what COVAX has achieved so far. It was really great to hear from Dr. Johannes the vaccine rollout experience in Ethiopia so far. So what is COVAX? Well, It's a novel, one-of-a-kind, unprecedented, multi-stakeholder, multinational public-private partnership that was launched in 2020 in response to the COVID-19 global pandemic. The initiative brings together CEPI, Gavi, the World Health Organization, and UNICEF, and we're a key implementing partner leading on the procurement and distribution of vaccines. Beyond the 4 leading agencies, though, the partnership includes developed and developing country vaccine manufacturers, the World Bank, governments, global health organizations, scientists, private sector, civil society, and philanthropic organizations. So fundamentally, our goal is to make 2 billion doses of COVID-19 vaccine available by the end of this year to up to 191 participating countries, including both higher income and lower income countries. And these countries combined represent more than 95% of the global population. So this is really the largest vaccine procurement and supply operation ever. COVAX is a platform that has supported the research, development, and manufacturing of a wide range of COVID-19 vaccine candidates. The COVAX facility, importantly, is also a financing instrument to allow governments, regardless of their ability to pay, to have proportionate, fair, and rapid access to COVID-19 vaccines to protect their populations against this deadly disease. So far, the facility has raised $6.3 billion of donor funding just for the 92 countries that are low income or lower middle income countries and whose doses and international freight will be financed via this funding. The other 98 upper middle income and high income countries who are participating in COVAX are expected to fully self-finance their participation, and in some cases are also receiving support from the World Bank and other banks. But by pooling buying power across all of these countries, COVAX could increase our ability to secure doses from manufacturers when there are so many competing pressures on their supply. So we have a portfolio of 11 vaccines or candidates across 4 technology platforms. Now, in terms of our objectives, as I said, securing 2 billion doses this year, and we started with, an objective that is ambitious, but we hope we can achieve. And it's just to start with for this year. Of course, countries definitely need to receive more than 20%, but COVAX is a starting point. Also, of the 2 billion doses, we want to ensure that at least 1.3 billion donor-funded doses are available to the 92 lower-income countries. And the goal of targeting 20% of the population is based on really just reducing deaths and helping countries dampen the most acute phase of the pandemic by prioritizing frontline health and social care workers, as well as individuals with greater risk of severe or critical COVID-19 disease. So far, COVAX has actually already negotiated to contract 3 billion doses this year, but notably the lion's share of those doses are meant to be available in the second half of 2021 as manufacturing is scaled up. So just briefly to go over UNICEF's role, and of course, we're always working with our COVAX partners and others. We're leveraging our experience as the single largest vaccine buyer in the world and working with manufacturers and partners for COVID-19 vaccine procurement. Now, normally, we already every year procure 2 billion doses of vaccines for routine immunization and outbreak response on behalf of nearly 100 countries. But our work for COVAX will actually almost double our footprint, just to give you a sense of the scale. So in collaboration with PAHO, who represents the Americas, we're leading efforts to supply doses, particularly to the 92 lower income countries. And we're also coordinating procurement for all 191 countries. Quite importantly, we've been working very closely with freight forwarders, logistics carriers, for the mammoth supply and logistics operation at hand. And we've actually estimated that UNICEF could transport up to 850 tons of COVID-19 vaccines per month. So to this end, we've established the Humanitarian Air Freight Initiative, and we've had amazing, tremendous support from IATA and lots of different airlines. So it's really been heartwarming to see the response. We've also been working with partners, with governments around the clock to ensure that countries have plans in place in advance and they're actually ready to receive the vaccines as soon as they arrive, with appropriate cold chain and injection equipment in place and health workers trained and available to dispense them. And critically, we've been playing a role in efforts to foster trust in vaccines, delivering vaccine confidence communications and tracking and addressing the misinformation pandemic that's taken hold of the world. So now to give you a sense of sort of where we are today, well, overall globally, it's been 121 days since the first country started vaccinating, and at least 674 million vaccine doses have been administered globally. Vaccine campaigns have started in 190 countries, and I'm very proud to announce that in just a month and a half, today COVAX reached a major milestone, having delivered life-saving vaccines to over 100 economies since we made our first international delivery to Ghana on February 24th. So far, more than 38 million doses of vaccines have been delivered by COVAX, including to 61 of the 92 lower income countries. And actually, just before I end, I was looking at the statistics and the information we've gathered, data from our regional offices, the Ministry of Health and WHO from different countries, and that of the 40 countries on the African continent who have started vaccination, on average, 75% of doses that have been received have been used, which is truly an excellent start. So I'll stop here. Thank you very much.
Thank you, Tara. That's fun. That's amazing. And the numbers do really tell the story of what's been going on since the whole world started vaccinating, but also since Africa started vaccinating. I remember when Ghana got its first shipment from COVAX. Has COVAX faced any challenges? Because it all seems to be going really, really well, but the scale of what they're trying to do is immense.
Yeah, I mean, sorry. Can you hear me clearly now?
Yes, I can.
Okay, thank you. Sorry about that. I was having a bit of a technical challenge. So of course, indeed, just given the scale and the scope, of course, we've had several challenges. And I think I would say that we're problem solving every day, given the novel nature of the partnership. So I think there's two key sides to the challenges. One is the supply side. Now, obviously, globally, we're in a constrained supply scenario, especially this year. Everyone's doing the best they can to accelerate manufacturing at scale. But of course, biological products like vaccines, they're highly complex and require significant lead time. And even though, we plan to have a constrained supply scenario, there are still bumps along the way in everything we've planned. So for example, last week, we learned of delays with a few of our vaccines, which you've probably seen in the news. And of course, we have been set up so that we source a wide range of vaccines from different manufacturers, trying to mitigate some of these risks through our portfolio approach. And then the other set of key challenges are on the demand side. So as I already touched upon, vaccine hesitancy can really reduce the world's ability to get this pandemic under control. So we have a lot of expertise in this area. And, we actually work country by country on social listening, where we try to monitor and respond to real-time news and social media around vaccines. And really, we're trying to educate and inform people about the safety and efficacy of vaccines. And then finally, on the demand side, I think it would be remiss not to touch upon the fact that as we do scale up, which is absolutely everyone's ambition, in fact, there will be more challenges on rolling out vaccines. I mean, we need to ensure that countries have systems in place that they've never needed before, from human resources to physical infrastructure to know-how and expertise. So to ensure this, there's also a need for sufficient funding, I think. And to that end, UNICEF is fundraising almost 500 million to cover the in-country logistics needs and in-country delivery needs of the 92 lower income countries, as well as our humanitarian delivery costs.
Okay, great. Thank you so much. There are more questions from you, but we'll tackle them during the Q&A session. Thank you, Tara. And here we have another pop-up question. So I encourage you all to please respond to this question as well. Thank you. And now I'd like to hand over to Dr. Dembi from the CDC, who'll be speaking to us about multi-stakeholder vaccine management in Africa and telling us more about the Africa Vaccine Acquisition Trust team.
Excellent. Great pleasure to be here. I think, would you allow me to please share my screen?
Yes,
please go ahead.
Okay, just give me a minute. Seems like I have a couple of documents to close here. So anyway, before I get there, let me just trying to be sure that I get that done quickly. Okay. Yeah. Sorry. Can you see my screen, Leah?
Not yet.
Not yet. Let me close this again. Yeah. Okay, should be fine now. So I'm just trying to. Okay, good. Yeah, with the apology for that. So I see. I hope you can see it now.
Yes, we can. Thanks.
Excellent. Thanks so much. I think thanks again for inviting Africa CDC to this very important forum for discussions on Africa CDC COVID-19 vaccine strategy and also the status of COVID-19 vaccines rollout on the continent. So first, I think I would like to invite all of you to the virtual conference, I think a continental summit that we're organizing around Africa's, around vaccine manufacturing and capacity for health security. Very important, so as to ensure that we build capacity, leverage on existing capacity for local vaccine manufacturing. I think that's very important. We all agree that if we had capacity on the continent, it would have gone a long way to be able to cover our need. At least the target of 60% that we've set to the Africa Union vaccine strategy. I think this slide is quite clear and kind of illustrate, at least from now, where we stand in terms of rollout. It's more colorful than we had before, but the point here we're trying to highlight the fact that it's still a very slow rollout of COVID-19 vaccine on the continent. But again, I'm going to give you some good news here. It's not as bad as we think. I think things are moving in the right direction. Okay, so I mentioned the vaccine manufacturing. This is the connection between those two. The first point here, we aim at vaccinating through the Africa CDC and then Africa Union Initiative 60%, at least 60% of the African population. If you look at it, it's not over-ambitious. If you look at the US, 80% of the American population. If you look at Italy, 80%, China, 70 to 80%. That's very important because that's the really threshold at which you can actually reach herd immunity. If you look at some of these infectious diseases like measles alone, there's some computational analysis showing that really to eradicate or to reach herd immunity just for measles, you need to at least vaccinate 80 to 90%. So here we're dealing with a new virus. And then also we really want to be sure that we get it right at the early stage. Vaccinating 20-25% means that we're going to be actually keeping or being with this virus for quite some time. And this is going to be very important in terms of movement, in terms of restoring our economy, and then also at least our livelihood. So we have a formula, very simple, from the Africa CDC, vaccines. That means you have to acquire the vaccines through several deals. We all agree that it's a very competing and challenging process. Now you have the vaccines, and that's what we're facing currently with some of the countries, vaccination. We really have to now ensure that we inoculate at least those that actually need based on the prioritization that we all agreed on. So we have a concept within Africa CDC, and then we plan to roll out anytime soon the vaccination centers. We're going to probably set up some of these cities like a mega vaccination site. Let's say Abuja, a large city like Abuja, or even Addis Ababa, we can set up like 20 mega vaccination sites so as to ensure that we decongest the already overstretched immunization program. You can confirm countries that have received their supplies through the COVAX facility, the rate at which the vaccination, inoculation is going on, is very low. And then we need to really think out of the box. We're going to not just ride on the existing facility, but being a little bit innovative in ensuring that we provide an enabling environment to be able to roll out COVID-19 vaccines. I think that's really go a long way. I think from experience and also using country vaccination deployment plan, that's very critical at this stage. So a part of this exercise in terms of ensuring that we have a kind of tracker, and we've set up a dashboard Very simple. That's go live by tomorrow. You all been able to have really real-time information on the availability of the supply, those administered, and then the types of vaccines that have been administered. Also, that's a very good exercise to ensure that we keep track of what's going on the continent. So the COVAX facility, I think the previous speaker touched base on that, but we are very interested. And I want to be very clear here, the COVAX facility complement the African Union initiative, very important. Though vaccines being delivered on the continent, we as African Union, we strongly believe is part of the continent, vaccines that we need to ensure that we as African Union and member states really roll out in a very fast and a very smooth manner to ensure that those that are in need will receive those vaccines. It's very important. Those precious goods now, product now need to be used, and that's for good use. So the AstraZeneca, I think at least that's will form the backbone of the COVAX facility. And then that's what you can see, over 30 countries now have so far received that, at least AstraZeneca vaccines. But what I'm going to tell you later on is that we do have a mixed pattern across the continent with different types of vaccines, and then also that are being rolled out. But what we're looking in terms of analysis is that there's a gap that we need to fill in. If you recall, I mentioned 20 to 25% will be through the COVAX facility. Our target is a 60%, at least 60%. We can aim to 80%, but that is again based on availability of COVID-19 vaccine supplies. So it means that there's a gap there we need to cover. So if it's quite clear, we have about 40% that we need to outsource. Now, how do we get there? So as part of that initiative, the African Union, through the African Vaccine Acquisition Tax Team, we've been able to secure over $2 billion. And I'm happy to inform you that we've secured the first deal of over 220 million with J&J, which is a single dose vaccines. It's a game changer. And you all know, even just for medications, ART, I mean, for patients returning to the clinic for their visits, there's usually a rate of attrition, maybe within 30 to 40%. So if you introduce then the vaccines with variables of 2 doses, it means that the likelihood that people will miss at least their second dose. So this, the J&J vaccine is really what I call a game changer, because you get your jab, that you're done. So we have like 220 million doses have been secured with room to additional 880 million. So we are referring to about 400 million doses. Also, initiative from bilaterals and other vaccine manufacturers that are in current negotiation will go a long way then to complement that effort from the COVAX facility and even oversee the 60% target in terms of vaccine acquisition. So 2 things to really remember: the access. Then I think it's very important to laudable, and then it resonates very good that African actually took initiative. I think a bold initiative, think bolder, and then also out of the box to be able to, one, secure fund for access. I said purely African supported funding, the $2 billion. And then that financing will help them cover that need for the continent. So now let's have a deep dive. Not all our countries have so far either received vaccines through the COVAX facility, either some have actually claimed their allocation. I say claim because through the African Union initiative, what we did was to allocate vaccines for the 55 member states with option to them to claim that allocation. That is the equity, the principle of equity. So all the 50 member states had that opportunity to either claim for the Pfizer, the J&J vaccines, and then other vaccines acquired through bilateral arrangement on our platform, the African Medical Supply Platform. So they had the deadlines of about 2 months to claim the allocation. So some didn't claim it. So half of those 55 did claim their allocations, and then those vaccines were reassigned to those members that needed more. So I just point out that because the question that come to countries that have not had access or have no vaccines allocated. No, there was a deliberate process to ensure that all member states have access. But again, there will be a second round, a second phase, where those that have not claimed during the first phase have the option again to claim their allocation. Again, the equity principle, and then also timely access to vaccines. So far, 26 countries have acquired, this is acquisition, not vaccination. They've acquired about 20, they have at least coverage, about less than 30% vaccines allocated or claims or acquired or delivered to them that will actually be able to immunize at least 30% of their populations. Then 6 countries so far with no data. I think we're working closely with those countries to ensure that we provide support. But so far there are 3 sources: the COVAX facility, the AVAD facility, and through bilateral. You'll be surprised. Through bilateral, we have over 10 million doses on the continent out of the 30 million doses so far delivered on the continent or acquired. I think this is significant. And then that's also showed that there's a deliberate attempt by member states to have access to COVID-19 vaccine supplies. I think it's very encouraging, I think from that perspective. So now, in terms of coverage, within 30 to 60% means that they have at least vaccine supplies that will enable them at least to vaccinate between 30 or 60% of their population. I think you can see the list. And it's also a very clear sign. Some of these kind of mixed or hybrid acquisition of sources. You can see countries like Uganda, they got some through bilateral and then through COVAX, and they also applied to have a vaccine through the AVAD, facility or mechanism. I think it's encouraging as well. So you see that movement to get access to those supplies, very important. I think that's why, again, the vaccine manufacturing company I did mention at regional level, continental level, will really complement some of this effort and ensure that member states have a way to tap into getting access to COVID-19 vaccine supplies. I think these are the top 8. They have acquired enough vaccines through different sources to be able to vaccinate at least their 60%, falling into that dotted line and projected target from the African Union. I think that's, again, through those different sources. I think we're just going to be quickly, I'll run you through, you can see that again, we have at least 21 countries with so far, rolling out AstraZeneca vaccines, countries, at least 6 with AstraZeneca and Sinopharm. I think the Sinopharm and then Sinovac, Sputnik, and then the J&J vaccines so far being rolled out in South Africa. And anytime soon, in a couple of weeks, now we'll have at least 27 countries that will be rolling out the J&J vaccine. So I'm not going to touch base more on them. We all know we prioritize healthcare workers and people with comorbidities. But the point I'm trying to make here, which is very important and critical if we want to really mitigate and probably slow down the progressions of this virus on the continent, is that we have a pretty young population in Africa, 60% at least. We're now looking at, that's very good, healthcare workers, but if we do not cover that group, that age group below 18, we're going to be having a reservoir that will be fueling constantly and this epidemic. So we really have to think very carefully here. You vaccinate the adult population, you've covered the 60%, but the virus is spreading among those younger population, which represent a huge chunk of the African population. I think that dynamic and also that specificity need to be taken into account how we move forward with our vaccination program. I will leave you with 3 key messages, 3 critical challenges: access to the supplies. We've tried as much as possible. I can tell you every single day, we meet for 5 hours just to discuss how to get access to more supplies for the continent. Then second, significant logistics challenges. That's very clear. You can do your mathematics. If you get a country like Nigeria, they've received over 3 million doses, but they have vaccinated less than 600,000 people in more than 6 weeks. That's very low. That is very low. Then the third one is the mutations with vaccine efficacy. So what we plan really to now move into risk communication and community engagement. We really want to see people coming out, head of state, influencers, religious leaders, so that we can scale up and then roll out these vaccines and be sure that we get to the level. Because in the next coming months, that's going to be an issue with the vaccine passport, where you don't have a jab, you're not going to be getting the flight to travel to where we like to be. So, and then there will be restriction of movement, and the free trade agreement we just launched as African Union is going to be having seriously been impacted. Again, thanks very much for inviting us. Usually a pleasure to be on this panel, and over to you.
Thank you so much, Dr. Dembi, for that presentation. There's actually been a lot of questions that have come in from the CDC. So the team is actually looking through all of them, and I'll be posing them to you during the Q&A session in a little bit. So thank you very much, Dr. Dembi. So I'd like to now hand over to Sanjeev Gadhia, who will speak about Astral Aviation's distribution of vaccines for COVAX and the AVAT. But before he speaks, here's a sponsor spotlight on Astral Aviation.
Thank you, Kaushal, and good afternoon and good morning to everybody. It's such a great pleasure for me to take part in this event today, and I'd like to thank AHBS for convening this very important platform so that we can be able to learn and share some of our experiences in this very important task of the transportation of the COVID vaccines in Africa. I am the CEO of Astral Aviation. We are a cargo airline, and we have been chosen by the vaccine companies to provide a very reliable and efficient transportation for the COVID vaccines to different parts of Africa. So I'd like to share with you a few slides on my presentation and to share with you some of the things that we're actually trying to do to make sure that the transportation of the COVID vaccines are actually done in an equitable manner so that every country in Africa would be able to receive the vaccines as and when it's required. Next slide, please. Just a quick introduction about Astral. We are a cargo airline based out of Kenya. We've been operating a fleet of 14 cargo aircrafts. We've had a lot of experience in the transportation of not only vaccines, but also pharmaceutical items in the last 20 years. And we've done a lot of work for UNICEF, WHO, and some of the organizations that are actually involved in the transportation of pharma. We're also very grateful to be appointed by UNICEF to partner with them on the transportation of the COVID-19 vaccines for the COVAX facility. And in addition to that, we're also very grateful to the African Union to be given the opportunity of transporting the vaccines on behalf of AWOT. Astral Aviation has a very unique pharmaceutical division where we provide specialized handling. We have IATA qualified personnel, and we take the whole transportation of the COVID vaccines very seriously by giving it high priority. And we offer a very unique repacking and re-icing service at our hub in Nairobi. At our hub in Nairobi, there is a world-class facilities for the storage of the COVID vaccines. And I'm very happy to inform everybody that Nairobi can actually store up to 200 million doses of vaccines for the rest of Africa in two different types of temperature settings. First is the 2 to 8 degrees, and the second one is the minus 15 to minus 20 degrees. And this facilities I'm actually talking about is at the airport and not even outside the airport, which really makes a very big difference. In terms of aircrafts, our fleet is very diverse. Our smallest aircraft can actually carry 1 million doses, and our largest aircraft can actually carry 25 million doses. So we've got 6 different aircraft types, which can be able to carry different types of vaccines into Africa. And we believe that we have the largest fleet diversity of any African airline in the continent. Next slide, please. Now I'd just like to quickly touch upon on what we are doing for UNICEF. And again, very grateful to Tara and her colleagues in Copenhagen for providing a very specialized flow of cargo, or especially of the COVID vaccines and also the syringes into Africa. And so far, what we have done for UNICEF is that we have transported 132,000 doses of vaccines from Mumbai into Juba in South Sudan. And this was actually done via the Nairobi hub. And what we also did was we also brought the syringes from Dubai into Nairobi, and then we consolidated it with the vaccine shipment, and then we transported it to Juba in South Sudan. And then just about a week ago, we transported the first flight of 360,000 doses of vaccines into Aden in Yemen. And this was actually done with a combination of bringing the vaccines from Mumbai to Nairobi and to bring the syringes from Dubai to Nairobi, and then put it on the same aircraft which flew to Aden. And this was a very unique moment because this was the first flight that arrived into Yemen with the COVID vaccines, and we look forward to transporting many more. Next slide, please. Now I'd just like to share with you some very exciting things that we've been doing for the African Union and for the African Vaccine Acquisition Task Force. So what we've done so far is that we've actually transported just under 900,000 doses, which were actually done to approximately 12 countries in West and East Africa. And this was actually performed on a CRJ-200 aircraft, which we call the Vaccine Buster. This aircraft is very unique because on the same aircraft, we were able to transport vaccines to 9 countries in Africa, which we transported within a period of 36 hours. And then the rest of the vaccines were actually transported into the Nairobi hub. So it's really great to actually show that through collaboration, we can be able to reach every airport in Africa so that no country or no person is left behind, especially when it comes to the transportation of the COVID vaccines. Next slide, please. Now, this is my last slide, and I'm just going to talk about some of the challenges which we are experiencing. And again, the biggest problem that we have in Africa is that there is a lack of infrastructure and cold storage facility, and this is a reality. But the other problem is that there is just not enough vaccines coming into Africa. There's definitely a very limited supply of vaccines coming in. And also the communication on the availability is proving to be a big challenge. There's also some level of work that needs to be done towards providing more information about temperature control and packaging, which is something which is very important for the supply chain to be very efficient. Forecasting is a big problem. You can never be able to forecast when is the next batch of vaccines coming in because of the recent geopolitical problems with the supplies. And there's always going to be a problem when you're going to get low volumes of vaccines and high volume of vaccines. So what I really believe is very important is to make sure that the forecasting is actually done in a timely manner so that we can actually make sure that the entire supply chain is as efficient as possible. Again, the passenger aircrafts are not flying so much at the moment, which is really good for us. But there is a very big shortage of aircraft and air freight connectivity to and from Africa. And this makes it very difficult for airlines like us to actually now be able to transport vaccines, which previously could have been done by passenger aircrafts, especially to very remote locations in West and East Africa. Again, we have many limitations on the transportation of vaccines, especially the Pfizer vaccine, because of dry ice being a limiting factor. We're very happy that the AstraZeneca vaccines and also the Johnson & Johnson vaccines do not have the dry ice requirement. But any vaccines which require dry ice has a certain limitation on the carriage of
I think we've lost Sanjeev there. He was towards the end of his presentation, so I'm sure we'll get him back so that we can ask him some questions during the Q&A section. But in the meantime, I think we can hand over to Dr. Ernest Dauko, who will speak about how technology can help in vaccine rollouts. Before he speaks, there's a sponsor spotlight on Broadreach Healthcare.
To save one life, the entire health system must work together. That's hundreds of healthcare facilities, thousands of doctors, nurses, and health professionals, millions of data points. To find solutions to challenges like meeting targets, managing a large workforce, preventing disease outbreaks, supply chain, resource allocation, reporting. We need the right information at the right time to make the right decisions and the right tools to drive results consistently and at scale. We must understand how people gather, receive, and use information. We must understand how they work. That's where our consultants come in. They take our clients on a change management journey to reimagine delivery models, workflow processes, optimize staff performance, unlock barriers to adoption, and unleash staff potential. We believe in the fourth industrial revolution and the power of technology to boost staff productivity and transform healthcare delivery for all. We use Vantage, the AI-powered performance coach, to make staff more effective. It takes disparate data, turns it into recommendations, and guides users through step-by-step actions to deliver the greatest impact, consistently and at scale, for the healthcare system, for the individual. Technology is part of the solution. A supercharged workforce is the quantum leap. How do you save one life? You start with data, you end with action. We are Broadreach, empowering action, changing lives.
So thank you so much for this opportunity to speak with you this afternoon. Vaccinating, 720 million people across the African continent, and if we give ourselves 12 months to do it, assuming we have 220 working days in a year and 8 hours a day, would require more than 3 million vaccinations per day, and that would be more than 400,000 vaccines being administered an hour. If we take a country like South Africa, where the target is 40 million, that would be 182,000 people being vaccinated per day, 363,000 doses per hour. And if it's a double dose, it will be double those numbers for these numbers that I've quoted you. So WHO very rightfully, given the gargantuan task at hand, advocates for what they call a whole government approach. And this means maximizing the use of all national capacity, and be it public, private, NGO donors that can contribute meaningfully to this effort. So as Dr. Morgan Chetty, who's the chair of the Private Sector Federation here in South Africa, always says, vaccines on their own do not save lives. Vaccine programs save lives. And I believe we can implement, successful vaccine programs by doing just 5 things well. And I'm not surprised to hear about the slow progress, even when the vaccines have been delivered, because I always say the day those pellets arrive in the airport is when your real challenges actually begin. And it's really important, therefore, to address these 5 factors. And all of these 5 factors are very heavily data and or technology dependent. So number 1 is you must know the number of people who need to be vaccinated in each priority phase and where those people are in your country. So that's number 1. So our Vantage platform enables you to actually do that. Number 2, you have to ensure that people are informed, educated, and ready to access services in the right way. And this is key because demand management is actually a lot more important than most people think at the outset. You don't want 200 people arriving in the morning, but 5 people arriving in the afternoon. And you want them to access the vaccine in the right locations based on the staffing and the capacity and capabilities of those facilities. So getting people informed and educated in the right way, running the right community mobilization campaigns, and doing that in the right way, quickly, consistently, and at scale is, again, some solutions that Vantage offers to provide workflows that help the teams who are doing this education to do it properly and at scale all the time. Number 3 is knowing that the health system and the facilities are ready, that the sites are trained, they have enough vaccines, they have enough supplies, enough commodities, enough equipment on an ongoing basis. This, again, For this need, Vantage again provides real-time or on-demand site readiness assessments. So at any point in time, you can see how ready that site is based on the demands that are going to be placed on it, and you can mitigate any gaps you have prior to the site actually being hit by that demand on a Monday morning. Number 4 is knowing that everyone is doing the right things in the right places at the right time and delivering on their mandates. So for example, if it's someone who's conducting vaccines, if we know that in order to hit target, every nurse must vaccinate 10 people a day, you want to know that every nurse is vaccinating 10 people a day. And more importantly, if they did not hit 10 today, you want to understand the reasons why, so that you could help mitigate that, so that they can stay on target for us to deliver on these grand goals. And I don't need to emphasize, it's been covered already, why it's so important that we stay on target, to avoid a new variant coming in and taking over and having us to start over again, to avoid, the setup of these reservoirs that will continuously feed us, in essence, new epidemics that, undo the crazy efforts that we've gone through to secure what we have so far. And then finally, number 5 is knowing that everyone who needs follow-up services is actually getting them, meaning that people who need a second dose are getting a second dose, or people who have adverse events are being addressed for those adverse events. And likewise, the Vantage platform has an adverse event monitoring system that allows you to do this over the long term, because as you all are aware, these are drugs that for the first time are being implemented in large populations, and we just don't know, for example, the duration of protection, the long-term side effects that might actually incur, and we need to follow this population with diligence. So it's not just a matter of getting shots in arms and then saying the job is done. We actually have to follow these populations for quite a long period going forward until we learn a lot more about whether this virus will be with us like the flu on an ongoing basis, or actually is a candidate for elimination because we get our vaccine programs right and get them scaled up properly. So you'll notice that these 5 issues, knowing the people to be vaccinated, ensuring they're informed and accessing services in the right way, knowing that your health system is ready, knowing that your staff are all doing the right things in the right places, and finally knowing that the follow-up is happening as necessary. These 5 issues are the same for every disease we need to manage. And it's a theme I'll keep coming back to, because I do believe at the moment, the way we are even approaching COVID, it's the right thing, don't get me wrong, but I do believe we need to think a little bit more broadly than a single disease focus, because COVID is forcing us in essence to do so many things we needed to have done right for our health systems anyway. So the way I put it is, if we're going to have 60% or 70% or upwards of populations forced to interact with the health system in a very direct way because they need a vaccine, can we use that opportunity to check on some other things, to address some other things, be it diabetes screening, hypertension screening, cervical cancer, whatever we can do to piggyback on this, so that this investment isn't, again, a single unipolar investment, but rather can be spread more broadly, in fact, act as a catalyst for universal health coverage. So behind these 5 things are hundreds, if not thousands, of supply and demand elements that must be coordinated and orchestrated quite impeccably. And the way to be able to do this is you need a system that allows you to maximize what you already have, treat those elements of what you have as an orchestra, and then you need to orchestra conduct this thing in the right way. And Vantage basically, in the hands of the orchestra conductors, who are the leaders in government, leaders in private sector, allows you to do this orchestration so that all these elements and members play the right song at the right time and deliver the right results. So finally, I'd like to say is, countries have made billions of dollars of investments in Africa in IT systems, data systems, etc. I do believe that these systems can all be repurposed or focused on assisting with COVID. And we need to be, in order to move quickly and maximize on our scarce resources, we should avoid blue sky approaches where we're starting with new IT from scratch. We must look at the value chain, understand what technologies we already have that can play a role in that value chain, and ultimately then use systems like Vantage, which basically allow you to mine the synergies from your systems you're already invested in, to allow you basically to do a lot more, much more quickly than trying to acquire something new from scratch and roll it out under the auspices of the Ministry of Health. So for example, if your Home Affairs Ministry in your country already has a biometric system, why should a Ministry of Health be buying a brand new biometric system that's never been used in that country from scratch and going through years of learning curve and teething issues that they need to, in order to just get it right, in an epidemic that is changing by the minute on us as we speak, right? So I'm a very strong advocate of look at what you already have that's at respectable scale, whether it lives in private sector, NGO, government already invested in, and use those maximally. And we have a system that can unlock the power that resides in your resident technologies that you already have, and to do that in the most cost-effective and minimal cost way possible. So I wanted to just share this with you. And I always say, I always feel odd when I have to do presentations like this because I feel like you're selling your product in essence. And what I tell people is, find the thing that will work. The 5 things I've mentioned need to be done, whether by Vantage or by somebody else. Find the system, find the way to do this. Otherwise, we will not succeed in getting vaccinations right. And as you've already seen from the map that was shown from our colleague from Africa CDC, we are lagging very far behind, despite the fact that I would actually like to posit we have probably some of the leading experience in conducting vaccinations in the world. So why are we lagging so far behind, even when the vaccines are present? So we can absolutely do this, but we need to basically focus around the right expertise and actually make procurements that we need to, make investments that we need to in getting these systems going so that we can catch up with and overcome and tackle this disease effectively. So I thank you for your time, ladies and gentlemen, and I really look forward to what I hope will be a very rich discussion across the rest of this engagement. Thank you.
Thank you, Ernest. Those 5 points are definitely really key. And I think that we can use those 5 key points when it comes to managing any disease across the continent. We haven't just dealt with COVID. We have a massive infectious disease epidemic as well. So those are definitely lessons that we can learn from. We do have questions from you, which I'll pose to you during the Q&A section. So I'd actually now like to hand over to Professor Asor to go through his discussion today on vaccine hesitancy and community preparedness for the vaccine. Over to you.
Yeah, thank you very much. I work for AMREF, and I think many people know that AMREF does a lot of work with communities across Africa. And the last 1 year has really been a time for learning for us when the pandemic has been really taking hold in a number of countries. And so what I'm going to talk about is really some lessons we are learning when it comes to the vaccine issues. The first thing is, for a long time, we have been defining what hard-to-reach communities are. And whenever we talk about hard-to-reach communities, we previously talked about geographically dispersed populations, which are difficult to reach, or those which are culturally closed and averse to modern medicine. And sometimes we've talked about slum communities which are deprived and are unable to get healthcare because they cannot either afford insurance or pay out of pocket. So that is how we have seen hard to reach communities before. And whenever we talked about universal health coverage, we talked about all these things and the need to leave no one behind because of geography or culture or ability to pay or health system not reaching them. But what we are learning with COVID vaccine and COVID in general is that the definition of hard to reach is actually changing. And the first thing we are noting is that when we talk of hard to reach, when it comes to the vaccine, COVID vaccine in Africa, there is a group with no information. They just don't know what it is. They don't know what this vaccine is about. And so they are not reached and they will not take it. The second group is those with wrong information. And we don't know how many people really have wrong information, but we feel it is a significant proportion of people in Africa who have wrong information on the COVID vaccine, based on myths, based on lack of knowledge, based on a lot of social media anti-vax messages that are going around. And so this also becomes a very difficult population to reach with vaccination. And the third group is really people at decision-making level who are not convinced with the science around vaccination, and who will not take leadership and lead their subjects or the people they lead into accepting the vaccine. And this is becoming really difficult because people think if the leader can't do it, it has to be something not right. It must be wrong. And they are looking upon leaders to do it. And we have a number of leaders in Africa at various levels, whether at community level, at a religious level, or at political level, who are not convinced that the vaccines are important and that they work and that they are a way of ending the pandemic. Now, so the definition, therefore, of hard to reach is changing, and we have to look at it differently for us to be able to reach the 60% that colleagues have talked about. The first thing that is really important, and we are trying to do this, is to do vaccine hesitancy studies. Vaccine hesitancy is refusal to take the vaccine when it is accessible. And there are many people currently who are vaccine hesitant in Africa. Now, these studies show us what each segment of population thinks. We know, for example, that health workers are vaccine hesitant, a number of them, and they have their different reasons. There are others who are vaccine hesitant for religious and cultural reasons. There are others who believe that the vaccines are not safe, so it is based on safety and effectiveness and so on. Now, when we do vaccine hesitancy studies, we are able to develop messages that are targeted to those different populations. And that is what we are doing in trying to reach the people who are likely to be left out when it comes to COVID vaccination. The second thing that is very important is that when we talk about vaccine budgets and vaccine programs, I know all colleagues have talked about procurement and transporting it and having health workers trained. It is very important that we do not forget that the vaccines will expire in the fridges and in the shelves in Africa because communities may not be ready to receive them. The budget that we put for the vaccine program must include community sensitization, community information about these vaccines, and must answer the questions that people have. I want to give you, as I finish, an example of what we have seen. We did a quick survey and we are still analyzing the data on community health workers. And you know, community health workers work with households. They're the ones who convince households that this is an important intervention. What we have found is that more than 50% of them don't feel ready to go and engage with households on the COVID vaccine. They feel they don't have enough information. They feel like any other community member that these vaccines may be dangerous. They are worried that their leaders are not taking the vaccines, and they have their own different values, cultural and religious values around the vaccine. So now if more than half of the people we are depending on to mobilize communities to accept the vaccine are themselves not convinced, and in fact, more than 50%, in some places as high as 70%, of community health workers are saying they will not accept to be injected with the vaccine. If they're like that, then things must be much worse in the community. I think right now we are dealing with the cream of the society who understand what this vaccination is about. And so when we bring 1 million or 2 million doses of vaccines to a country, we are seeing some uptake, and it is also very slow, but we are seeing some people taking it. This is the cream of society. But this is not going to stop the pandemic. The pandemic will stop when we move beyond that cream of society into the real community where people live. And so the need to put a budget there, prepare these communities, is as important as acquiring the vaccines themselves. And I will stop there. Thank you very much.
Thank you, Professor. So yeah, that's definitely a really key point, that we must move to communication with the community level to actually get the real uptake of the vaccine that has to come later on in the year. So yeah, thank you to all the speakers for taking us through the session. That was really interesting and engaging discussion. It's clear that there's no one-size-fits-all approach. However, collaboration is required. We do need the public sector and the private sector to work together to ensure that we can successfully deploy the vaccine to Africa. So now we have a few questions that have come in from the attendees today. So the first question I'd like to pose to is to Tara. So we're seeing that the prices of the vaccines from different manufacturers are different. How does this impact COVAX? Does it impact COVAX?
Hi there, Kaushal. Yes, of course. So, yeah, there I am. So price is, of course, one consideration. And I think, as Amit mentioned, our funding will go further with more affordable pricing. But COVAX's procurement objectives are multifold. So that also includes the speed of access to doses, so how quickly we could get doses in 2021, the quantity of doses available of a specific vaccine, and ensuring that we have a balanced portfolio with multiple different products from different geographies. And COVAX does actually expect to receive some of the lowest global pricing, noting our pooled purchasing power, and also that we are purchasing on behalf of some of the poorest countries on earth. So the facility has actually used push and pull incentives where possible for vaccine development as a way to keep prices affordable. So for example, speaking of push factors, we provided grants to manufacturers for R&D, and then for pull factors, we provided commitments to buy doses upfront through what we call our advanced purchase agreements, helping manufacturers offset the risk of production, including through providing advance payments in some cases. So we have, as far as possible, tried to negotiate affordable pricing.
Great, thank you so much, Tara. And now we have a question for Dr. Dembi. So currently we relied on vaccines from COVAX to be supplied to the majority of our populations in Africa via our governments. How do you think a private sector vaccine supply strategy would work for us to actually properly push immunization rates across the continent as the months go by and as we move into the next year of vaccinations? Dr. Dembi, are you there? Okay, I'll come back to his question later. So Dr. Ernest, we have a question for you. Are you there?
Yes, I am.
Yeah, okay, great. So we're a little over a year into the COVID-19 pandemic. In your opinion, are African countries adequately using the power of data and tech in their approaches to manage the disease and vaccine immunizations?
Thank you so much for that question, Kaushal. In my experience, at the moment, we're not. And I think what I've observed, in interacting with numerous countries is that there's a desire and a stated intention to benefit from technology like AI, the cloud, et cetera. However, they've tended to then very quickly then turn to say, but we're too overwhelmed right now addressing COVID in order to actually focus on putting those solutions in place. Mm-hmm. So I think we're kind of getting caught in this chicken and the egg situation where, for example, we've just finished this last wave. In the middle of the wave, no one even would take your call. Everyone was so busy saying they're too busy to do that. I even had a district that said, look, we can't afford your solution. Can you find the money? I found the money. And I said, you just need to hit send on this email to get the money. And they didn't even have the time to hit send to get the email to implement the system, right? So okay. I think the stated, the rhetoric isn't matching the practice at the moment. But my point is this, at some point, you have to make that commitment and just do it, right? Because things aren't necessarily going to get better for us. I was on a previous webinar where the Chief Science Officer from FHI 360 mentioned that there's a very good chance that this COVID might be with us like the annual flu, right? So in that case, we're not going to wait forever to say that we need to now finally button down and make these investments, which will actually help us tackle the epidemic. So in my experience, my humble experience right now, I feel that people are not making nearly as close to the investment that they need to make. A few people are accepting freely given systems, but that's not the way you're going to tackle an epidemic as profound and as aggressive as COVID, with a few freebies given by companies which they can only give you for free for a short while. It's not going to work. So I think we can do a lot better. And the solutions I think that are out there are very reasonable. In fact, much more cost effective than a lot of the things we're probably doing now. Thank you.
Great. Thank you so much. So Professor Assor, there's a question for you. Have we learned anything from the COVID-19 vaccine immunization program that we can then actually employ for our other routine immunization systems?
Yeah, I think it is the other way around. There are a lot of lessons from the routine immunization that we should apply to COVID vaccine. We are yet to learn much. Actually, right now, we are in the nascent stages of learning the obstacles that are making people not get the vaccine. But there are some lessons, like when you want to do a polio drive, you engage a system. You get the vaccine, but that is just a small bit of what you need. You engage the whole system, you make sure everyone is prepared from the very top to the bottom. Right now, the people who need to be engaged the most are not yet engaged. And these are the ones I was talking about, the community health workers, the households. The media is doing a bit of education. I wouldn't say it is as much as the anti-vax are doing. The social media is much more packed with anti-vax messages than with the messages that people need to hear. So I think the lesson for me is, let's borrow from what we already know that works. Before, for example, the cervical cancer vaccines were introduced, there was a lot of sensitization. We are doing very much in trying to acquire the vaccine with very little sensitization to communities on the COVID vaccine. I think that is a real.
Great, thank you so much for answering that question. We had lost Sanjeev from Astral Aviation as he was giving his kind of last bit of the presentation. Sanjeev, what is the one key challenge that you've experienced in the air transport of the COVID-19 vaccine?
My apologies, Kaushal. I lost you for a moment during the middle of my presentation, but I'm sure everybody got the message. We've had a number of challenges in the transportation of the COVID vaccine, but I really believe that the one challenge which is very important is the lack of information. And I really believe that that is something that needs to be improved. And I really believe it does not really have it's not really anybody's fault. I just believe that it's the circumstances of the geopolitics surrounding the entire supply of vaccines, because everybody had very high expectations that the vaccines are going to be manufactured and the whole world is going to be vaccinated in a very short period of time. And unfortunately, this has not happened. So we've had a mixture of emotions which have actually been triggered because of the slow delivery of the vaccines. And I really believe that the slow delivery of vaccines is something that is also good in one way, because it prevents wastage. It also enables the medical workers to administer the vaccines in a timely manner, especially when it comes to countries which do not have the resources of a large-scale vaccination program. So in the end, whatever happens for the best. But as a very key part of the logistics supply chain, one really needs to look at forecasting. And if I had a wish and if I wanted to have a forecast from the vaccine suppliers and the manufacturers and everybody who is involved in the supply chain, that if I actually had a wish that I would like to know what is the projection over the next 6 months, the chances are that it is everybody will not be able to get it right. And I really believe that it's because of a combination of different factors, the most recent being the decision by the government of India to reduce the exports of the COVID vaccines from the Serum Institute, which has actually affected Africa's flows of vaccinations and also will lead to a potential delay. So I really believe that these are some of the challenges which we are experiencing, and I believe that we're just one part of the solution, and we really wish that going forward, we will actually be able to get information which will enable us to plan our resources and make sure that we give the priority where it is required, provided that we have the information in advance.
Great, thank you so much, Sanjeev. Good to have you back as well. I'm not sure if Dr. Dembi is on the line. Are you there? Okay, so I think now we'll move on to quite an exciting part of our webinar. So you've all been answering some poll results from the pop-up questions that we've been projecting while the webinar has been going on. So we have the results for those in. So the first question we asked was, how should we accelerate the COVID-19 vaccination program for Africa? And a staggering 91% of you said that we should use a mix between public and private market-led authorization initiatives. This is very, very interesting. And actually, so far we have seen that it has been a public and private sector initiative. However, as we go on, like we said earlier, this is just the start for Africa. I think a lot of the private sector can get involved in things like sharing assets, so sharing facilities for vaccination, human resources, logistics, supply chains, data, technology. So there's a lot of room from the private sector, even potentially actually bring the vaccine in the future to push for increased immunization rates. The second question we posed was, what are the biggest challenges to distributing the vaccine across the continent? And actually, 39% of you said poor access to location and tracking technology for supply chain management. And this actually aligns it with what Dr. Ernest Darko was saying. Again, another 33% of you said poor cold chain capacity. And this again highlights what Sanjeev's company is doing in trying to ensure that we have cold chain capacity to bring the vaccines into the continent and then also supply them throughout. The third question we had was, which of the following are required for the effective rollout of the COVID-19 vaccinations? And 84% of you, which is the majority, said all of the above. Like we said earlier, actually, once the vaccine comes into our country, that's just the start. There's a whole range of interconnected processes that need to happen. So it's whole of government coordination, upgraded logistics and cold chain capacity, optimize human resources for health, digital data and tech infrastructure, and then proactive communication with the public, which is what Professor Aso was saying, to actually get acceptance and get people agreeing to vaccinate themselves. So yeah, thank you very much for everybody answering these polls. We'll also be putting the results of this into a report that we publish that will come out next week, which will have the key highlights of this webinar. So as we come towards the end of the discussion, I'd like to please ask each speaker to provide us with a one sentence parting shot focusing on today's topic. So what is your key takeaway? Dr. Mulliken, are you there?
Yes, I am here. Yes.
Yes. What's your takeaway for today?
Yes, thank you very much for this. An excellent, event. In fact, I have learned, a lot from this symposium, from this seminar. One of the big takeaway is, actually, the vaccine rollout that we were anticipating, at the beginning of this year was, where actually people, to come and get the vaccines, within a less effort. But we have learned that, not only in Ethiopia, but all over, Africa, still we do have, some kinds of, vaccine hesitancy or, a delivering issue. So for this, what's more important is actually, advanced planning and preparation is very, very, very important. But in addition to this, private sector involvement in a very important work streams like, in the communication, in vaccine distribution, and even in service delivery is also a very, very important one. So I think not only, a government-led effort, but this really important involvement, a multi-sector involvement, where even at times, communities are really involved to have, a very important, successful, vaccine delivery. So this is a very important, takeaway that I took, and really appreciate, for the organizers, for organizing this important, event. Thank you. Over to you.
Great. Thank you so much. Tara, what about you?
Sorry, I'm using two devices, so I always have a bit of a lag. Well, thank you very much for an excellent event today. And I think, I came in with the global perspective, but it was really great to hear more about what's happening on the African continent and all the specific examples, which are really ultimately crucial to us because, frankly, we think of, the global pandemic and we're focused on problems at a global level, but really ultimately for patients to get shots in their arms, it goes down to that completely subnational local level of what's happening on the ground. And from the start, I think, we've been concerned at UNICEF that there's been too much of a focus on supply. Of course, pharmaceutical interventions and investing in them, making sure they're available is critical. But ultimately, what happens on the ground is the most critical. And I think from what I've heard today, of course, there are many bottlenecks and challenges that we need to continue to address. Preparation is critical. We've also been saying that the country's having plans from the start, but there's just no easy solution. There are just so many challenges, and it's no surprise from high-income countries, the challenges are just insurmountable. We've seen that no matter the wealth, the size, the strength of a health system that a country has, there are just so many different challenges on infrastructure, vaccine plans, human resources, shortages of cold chain equipment, syringes, and just everyone feels like there's like a resource limitation. So I think that really my takeaway is that we need to continue to focus on what's happening on the ground. While we obviously have a nice aggregate global perspective, this is really paramount. Thank you.
Great. Thank you so much, Tara. Dr. Dembi, do you have a key takeaway for us from this session?
Yeah, I think that it's quite clear. Thanks to really all the presenters from this, and I feel it was really great to be part of this panel. The key message I feel we should take probably from my end is really ensure that the vaccines really get to those that are in need, and then those vaccines we really ensure that a kind of port to arm that be sure that these vaccines are really being rolled out efficiently on the continent. It's very important. I think it's going to send a strong signal. If you have 31 million doses that have been delivered and only 12 million administered, I think we're going to be judged based on that. So the international community, we're going to be looking to closely to those data. Let's be sure that we get that movement out, the community engagement, the risk communications, engage our religious leaders, political leaders to ensure that we roll out these vaccines, we deliver these vaccines we are in a very efficient manner. I think also be sure that we provide technical support to member states that are in need, I think, for those support for to be able to complete this exercise. We all agree it's a challenging time, unprecedented time, and it's not easy at this point to be able to to be on top of some of these tasks. Again, thanks so much for HBS, Amit and the team, and then also to you, Kausal, for really good moderation of this session. Thanks.
Great, thank you so much. We're really pleased to host you. Sanjeev, what is your key takeaway for today, please?
Thank you, Kaushal. I have 4 key takeaways. The first one is global solidarity, followed by collaboration, followed by information, and last but not the least, urgent action is required to defeat the new coronavirus outbreak. And with that, Kaushal, I would like to thank you and the entire team at AHBS for convening this very important webinar. And we're really grateful to take part in this. And we really believe that the information sharing can only be possible when you are in a platform like this. So thank you so much again for what you're trying to do as a company to promote the flow of communication between all the stakeholders in the vaccine transportation. Thank you very much.
Great, thank you so much for that. Dr. Ernest Darko, what is your key takeaway from today?
Oh, I think my key takeaway is that I think so much of how this is going to turn out is going to depend on our mindset. And I think what I've seen a little bit of so far is in our response over the last year has almost been a bit of a mindset of, well, the Western countries are going to lead the way and then we're going to follow, you know? And the map that we showed, for example, I don't think any of us is looking at that with surprise. And I think my quick points are this. One, we may have started out slow, but the most important thing is that we do it in the right way, right? Second point is there is absolutely no reason or excuse whatsoever why we do not have world-class implementation on the African continent. We're used to adversity, we're used to shortages, it's nothing new to us. So we should actually be generating the best practices on how you do this that the rest of the world can learn from. Because I do believe we have an opportunity very uniquely to show, even with low resources, but with good community mobilization and really maximizing how we spend each hour and each dollar, we can really do a lot more than other people potentially who aren't as efficient as we can. And it behooves us to be that efficient because our lives depend on it. And by the way, who said this is the last epidemic that's going to come, right? So we really need to get prepared regardless, and we can jumpstart all of the other long-standing deficits we've had by using COVID as a catalyst. Thank you.
Great, thank you so much. And finally, we have Professor Assur from AMREF. AMREF, what is your key takeaway from today's session?
Yeah, just listening to everyone, I see the value that each of us adds to this whole agenda. And I think we need to look at the vaccine program as a big program, and we are all contributing to it. And so we need to do our best in what we are able to do, and we will succeed all together. So the bigger picture there, and we are all doing our best, and we have to continue doing that and collaborating. I think that's my take home.
Great, thank you so much, Professor Assur, and thank you to all our panelists today. I'd like to ask Dr. Amit Thakur to say a few words today as well, please.
Yeah, thank you, Kaushal. You moderated this very well, and I think you brought a really important topic nicely galvanized. I want to thank the panelists from all parts of Africa and the globe, getting international perspective from Tara and the rest of the panelists giving a very deep insight in Africa. I want to thank the attendees who I noticed were from various parts of the world. But I just have, my 2 points are that we need a sense of urgency. I wish there was a poll here asking how many of you have received your first dose. It's almost like those who have received the first dose, there seems to be a lax sense of urgency. And I think it's up to us to improve the velocity of the vaccines by bringing partnerships that's innovative and pushing the government to make the wheels turn quicker. Can we do it? Of course, yes. Can we get more supplies quicker in Africa? The answer is yes. Could we ensure, you know what would be worst is to have some of these vaccines expire in these countries or be thrown in the Indian Ocean. That would be such a disaster. So I think together, wherever we are, the sense of urgency and making sure that more vaccines are administered in good time will be a good task for us. And maybe in 6 months or 1 year, we should do a review. Thank you, Kaushal, and great work by everyone. Thanks.
Thanks, Amit. Yeah, we'll definitely do a review in the coming months to see where we've reached from what we spoke about today. So on that note, on behalf of Africa Health Business, I want to extend a special thank you to our event partners who made this webinar possible. I'd also like to highlight 3 great webinars that you should all definitely register for in April and May. So one is on Monday 12th and Tuesday 13th April, the African Union and the Africa CDC will be hosting a session on Africa's vaccine manufacturing capacity for health security that Dr. Dembi spoke about earlier. So definitely save the date for that. On 22nd April, in partnership with Lumira DX, we'll be hosting a session on testing still matters, where experts will share best practices on national testing strategies for COVID-19 and the models of success. So we spoke about vaccines today, but a big part of actually addressing this pandemic is actually testing. And then on 13th of May, we'll be hosting the 4th thematic session in our 2021 webinar series, The Future of Health, Unlocking the Potential of Artificial Intelligence for Healthcare in Africa. The registration links for all these 3 sessions are in the chat box. So please do click on the links and register. And also please do save the date for all 3 sessions, which will have fantastic speakers on the panels as well. Finally, if you are interested in learning more about Africa Health Business and our services and partnering with us, please feel free to reach out to me or my team using the details on the screen. Thank you for joining us today and see you soon.
Thank you.
Thank you.
Thank you, everybody.